So we're here at the chair with Lauren, and Lauren has basically asked if she is a good candidate to do some whitening, and she is a good candidate. She is at the age of 18, but has let us know when we were talking to her about sensitivity that she does have a lot of root sensitivity on her lower teeth. And with whitening, we know that the patient really needs to do it consistently for 14 days. To not have any sensitivity and to make sure that she can comply with those 14 days, we're going to automatically just prescribe for her some of the Remin Pro. There's two ways to basically apply the Remin Pro. You could have the patient put it on with their finger and then rub it all around all the areas of the teeth, or you can have them wear it in the tray. And it doesn't really matter which way you do it. I personally like for them to load it in the tray because I just think it makes it easier, and it makes it easier for them to comply. So what I'm going to do is just kind of squirt a little bit out. I do give the patient a couple of these little brushes too, which makes it easier for them to spread it around in the tray. So I'm going to start and just put a little bit of material and just go all the way around. I don't want to overload it, but I do want to make sure that we have enough material for the patient to go over all the surfaces of the teeth. So basically, I'm just going to kind of take my brush and just really maneuver it in all the areas of the tray. The great thing about the Remin Pro is, again, this is a mint flavor, but it won't take her breath away. It's just very, very mild mint and actually pretty tasty. You gotta be careful because some people actually love the taste of this, especially the strawberry. And Lauren, I'm gonna have you open for me. And I'm not gonna push too hard. I just want it to kind of have a little bit of suction just to kind of hold the tray in place. You doing okay? And then we'll go ahead and load the lower. Same thing. And they may not even need a brush. You can see here it just comes out really nicely. I would ask the patient to wear these for about 30 minutes. I will tell you that I have a patient right now who has such severe root sensitivity. She's been wearing these every night for the last week just because she has such severe sensitivity and is really worried about the whitening. And she told me, she said this has been the easiest thing that she's been able to do, is to basically put those trays in, go to sleep, and then be able to whiten the next day. I'll tell you that Remin Pro works so fast that a lot of patients only need a few applications, but again, it just depends on the patient. When she takes these trays out, I always tell patients run their toothbrush under warm water and make sure you get all that paste out of the tray before you apply the whitening agent. She'll wear this for about 30 minutes at the least. I like 30 minutes at least every day for a few days before we start the whitening. And then once she brushes all this Remin Pro out of the tray, then she can load her whitening agent. I'd like for patients to wait another 30 minutes in between this application of the Remin Pro and the whitening, just to give the teeth enough time to soak all this Remin Pro in all the dentin tubule areas to make sure that it does help seal and we don't have any sensitivity. This is such a good indication for so many things. For patients that are going through chemotherapy, having radiation, mothers that are pregnant, it's a great way to get them to really comply by making trays. I just find it just makes it easier for them. Instead of having to rub it several times with their finger, we can just take some impressions and do this for our patients. As you can see, it's very, very comfortable. Again, 3 really good flavors, and it's just a nice way to make sure for us that the patient is not going to be hurting after they do the whitening or even before the whitening. And in this case, we're doing it before. There's no right or wrong. If you want to do it after the whitening, that's fine too. And sometimes right in the chair, when we set the patient up after we've done a whitening service for them, we'll apply this just kind of as a band-aid, just to make sure that they're not going to have any sensitivity. So I'm Shannon Brinker for CPS Magazine, and this is the Remin Pro by Voco America. For more information and indication for other Voco products, please check out our website at www.cpsmagazine.com, or you can also go to Voco's website at vocoamerica.com.